Cardiovascular disease is a broad term covering all conditions that affect the heart and blood vessels, such as coronary heart disease, stroke, peripheral vascular disease, angina, etc. It is mainly caused by fatty plaque buildup in your blood vessels, and the technical term for that is atherosclerosis. Can also be caused by arteriosclerosis, which is the breakdown of blood vessels too. So some quick stats on CVD in Australia. So the prevalence rate is still high, so it scales exponentially. So 1 in 4 Australians over 75 will have some sort of CVD. The incidence rate, so new cases, is decreasing. It is the current second highest cause of death in Australia, just behind all cancers. And the morbidity rate, so people that are being admitted to hospital and then requiring ongoing care, is increasing, and that's mainly due to our growing and aging population. Risk and protective factors for CVD. So risk factors first: age, gender, family history. Okay, these are all non-modifiable. If you're older, if you're a male, if you have family history of CVD, you are more likely to get CVD. Modifiable ones: smoking, vaping, hypertension, which is high blood pressure, and lifestyle factors such as poor diet, lack of exercise, alcohol consumption, etc. Smoking, vaping, and hypertension together are called a lethal combo. All right, so people that do both of these things are more likely to suffer from CVD in a bad way. Protective factors, other than the obvious ones of just doing the complete opposite of these things, we've also got healthy dietary habits, so diet high in fiber, low in dietary fat, etc. Regular exercise, so not only cardiovascular exercise, but strength training as well. And regular GP checkups, especially if you are like over the age of 50. And finally, where and for whom are these conditions changing? So First Nations people currently have a 2.1 times higher incidence rate of CVD and like a 2.8 times higher rate of mortality from CVD. Low SES groups, while low SES and high SES pretty much have the same incidence and prevalence rates, low SES have 1.5 times higher mortality rates simply because they don't seek out the care or they can't afford the care necessary. Rural and remote populations, as you go more remotely, it does increase in a linear fashion. They do have a 35% higher hospitalisation rate compared to metropolitan areas. And age and gender. So there is an increase in young adults actually being diagnosed with CVD. So we say young adults is like under the age of 55. And the male and female gap is actually widening. So while females do have lower rates of CVD, their rates are dropping faster than the male rate is. And that was your too long didn't study version of cardiovascular disease.